Muscles that stabilize the shoulder joint. Supraspinatus. Its origin is the scapula, the supraspinatus fossa. Its insertion is the humerus, the greater tubercle. And its action is to hold the head of the humerus stable in the glenoid cavity, and abduction of the humerus is the first 30 degrees. Next is the infraspinatus. Its origin is the scapula, the infraspinatus fossa. Its insertion is the humerus, the greater tubercle. And its action is to hold the head of the humerus stable in the glenoid cavity, and lateral rotation and adduction of the humerus. Next is the teres minor. Its origin is the scapula, the axillary border. Its insertion is the humerus, greater tubercle, and its action is to hold the head of the humerus stable in the glenoid cavity and lateral rotation of the humerus. And last is the subscapularis. Its origin is the scapula, the subscapular fossa. Its insertion is the humerus, the lesser tubercle, and the action is to hold the head of the humerus stable in the glenoid cavity and medial rotation and adduction. That's it. Muscles that move the arm. The pectoralis major. Its origin is the clavicle, sternum, and ribs 1 through 6. Insertion is the humerus, the intertubercular groove. Action is adducts, flexes, and medially rotates humerus at shoulder joint. And the latissimus dorsi. Origin is the vertebrae.
Wait. Give it a second.
Okay, latissimus dorsi is the vertebrae, or origins of vertebrae, and the iliac crest and ribs lower 4. Insertion is the humerus at the intertubercular groove, and action is adducts, extends, and medially rotates humerus at shoulder joint. And last is the teres major. Its origin is the scapula, the inferior border and lateral border. Insertion is the humerus, the intertubercular groove. And action is adducts, extends, and medially rotates humerus at shoulder joint, synergistic to latissimus dorsi. Alright, the muscles that move the forearm. Biceps brachii. Its origin is the short and long head of the scapula. The insertion is the radius of the radial tuberosity. And the action is it flexes the forearm at the elbow and supinates the forearm. The brachialis. Origin humerus, the anterior shaft. Insertion is the ulna, the coronoid process. And action flexes the forearm at the elbow. Brachioradialis. Origin is the humerus, the lateral supracondyle ridge. Insertion is the radius of the styloid process. And action is flexes forearm at the elbow. Last is triceps brachii. Origin is the scapula and the posterior proximal humerus. Insertion is the ulna, the olecranon process, and action is extends forearm at elbow.